We are now going to move on to our last panelist for this evening, Stefano. So Stefano, thank you for joining us this evening. And my first question that I'm going to pose to you this evening, having been involved in lots of research, what has been the greatest challenge in your research into dentine hypersensitivity?
Okay, good evening to all, and thanks to Victoria to have introduced me. Unfortunately, the time available for my question and answer session is very limited this evening, so I took some note of my laptop. I apologize for that. Well, my personal experience in dental hypersensitivity started in 2004 when I did my Master of Science thesis about this topic. I undertook a full review about etiology, pathogenesis, and at home and at office products to relieve dental hypersensitivity pain, to evocative stimuli, above all beverage and food, and there too. Over the next year, I suggested to my patient many at over-the-counter products for the management of dental hypersensitivity, and above all, many toothpastes specifically designed to relieve sensitivity. We know that dental hypersensitivity toothpaste use different strategies to obtain sensitivity relief, such as a potassium nitrate-based formulation that are designed to block the A delta nerve response to stimuli. And however, potassium nitrate-based toothpaste in the scientific literature indicate that are rarely able to penetrate deeply into the tubule, and clinical results are very inconsistent. An alternative approach is to attempt to occlude the dental tubes, typically using, for example, fluid salt. In practice, this therapy often only results in temporary relief from dental hypersensitivity because the dental tubules are not really permanently occluded by it, but this strategy provides a thin mineral, such as calcium fluoride or carbonated salt, smear layer that covers exposed dentine. This smear layer, as we know, is very unstable and susceptible to acid challenge, such as posed by carbonate of soft drink, orange, grape juice, wine, etc. I can say that in my clinical experience until I discovered BioMin F, I did not find any over-the-counter oral hygiene products such as toothpaste or mouthwash able to consistently relieve the pain of dental hypersensitivity.
Mm-hmm. And what did you observe when you started using BioMin?
Well, I met Richard Whatley in November 2018, and he proposed me to try some tubes of BioMin F toothpaste for my clinical management of dental hypersensitivity. I decided to try this new treatment concept because of my interest in bioactive technology contained into BioMin F toothpaste. Before our meeting, I had studied the features and the biological activity of bioglass in tooth mineralization, and so I found this opportunity very exciting for me. I can say that my first passion was my sister-in-law, and who had suffered from extensive dental hypersensitivity for many years, and for whom I could provide no solution for her and for all other my patients. my sister-in-law, in less than 2 weeks, confirmed to me that her dentine hypersensitivity had reduced considerably. This result has after remained stable even after a very strong acid challenge from vomiting episodes. And this indicated to me that mineral produced from BioMin F in dental tubulars are very strong acid resistant. I like to mention that this mineral phase made by BioMin F is fluorapatite and not an amorphous mineral layer, such, for example, the mineral layer produced by fluoride device, high concentration fluoride device. And fluorapatite is strong acid resistant, and BioMin F is able to produce it.
Yeah. And what were the next steps you took in understanding your clinical observations from BioMin?
Yeah, from the great result obtained in my sister-in-law, I was very interested to evaluate BioMin F toothpaste with 40 patients presenting extensive dentine hypersensitivity, substantiate my initial observation. The result obtained with this patient treated with the BioMin F showed me that the result obtained with my sister-in-law, for example, was not one-off experience, and that the fluoride bioglass technology is very effective when the bioglass added on toothpaste is exposed to our fluids.
Mm-hmm. And what were your findings from your practice-based clinical research, Stefano?
Well, after the first patients that report the optimal result in pain relief of the dentine hypersensitivity, I wanted to engage with other Italian desi and hygienist colleagues the use of BioMin F toothpaste. A dear friend of mine and colleague called Dr. Andrea Alessandri helped to me to recruit a quite high number of patients suffering from documented dentine hypersensitivity and evaluate BioMin F toothpaste. I can say that after a few months, we collected 29 patients recall and re-evaluation of their dentine hypersensitivity. Then we published the results of the pilot clinical study in Dental Tribunes Prevention #1 2020 journal, and which was distributed in print and online to Europe. The data, I'd like to show you some data of this clinical trial in this slide.
Yeah, okay. So I know you've been looking for clinicians to become involved in your current practice-based clinical research. What would you need from the participants who may wish to get involved in your research?
Yes, I'd like to engage more dentist hygienists in the use of BioMin F toothpaste for treating dental hypersensitivity clinical situation, and stand upon the patient-based original pilot study that I cited before. I would like them to select a suitable patient and collect the data after 2 weeks, twice daily application of toothpaste. And it's not important if the participant come to university or public clinic. Is important collectively get more data as it possible and produce a multi-scientific publication with a large number of the patients.